Start.
Hello, this is Dr. Trivedi, doctor working in this work clinic. May I confirm that I'm talking to Mr. Josh Hartnett, 78-year-old son?
Yes, doctor, I am. So you're taking care of my father.
Yes,
Doctor, I
actually,
really want to know about my father's condition. Okay, so can you
yes.
tell me? You know that he is a very sick person. So is it? It will be better, doctor, to hear from you.
Yes, yes. Okay, and uh, may I know that during our discussion, I'm here to help you to know more about your father and our management. And during our discussion, may I know that will it be okay if I note down some notes which will be
Whatever
strictly.
you want to do, would do you can do, doctor. Just I want to know about my father's condition.
Yeah, I get it. Well, at the beginning, may I know that how far do you know about your father's condition?
Okay, doctor. My father wasn't well for a long time, actually, and he's living with me. And his condition, you know that he had a lot of condition, like he had cancer in his lung, he had a heart attack previously, and he has some problem with his forgetfulness. So that wasn't a very severe thing, doctor. I took care of him regularly, and I even left my job to take care of him. But what happened to him that he couldn't move his one side suddenly. Previously, though he was doctor, he was somewhat bedbound. I think it would be somewhat housebound. He couldn't leave the house. But this morning, this type of weakness that made his condition worse, so that I took him to the emergency department. And I think that his condition is deteriorating very soon, doctor. So can you tell me, doctor, what is actually his condition?
Uh, well, actually, uh, yes, I am. I will tell you. I'm going. I'm here to tell you more about it. But actually, at this moment, mm, uh, actually, at this moment, we think that we are giving our best possible treatment to him at this moment. But uh, it seems he has a lot of health issues from earlier on. At this moment, uh, we cannot. He is not. I'm sorry to say that he is not in a very good situation at this moment. Okay, because he had some previous condition like heart attack, some problems with his memory, and also some lung condition as well, which I think you know it. You told about lung cancer, and also he has some breathing issues like COPD. At this moment, I'm sorry to say that his consciousness is not so well. May I know that after getting admitted, did you meet your father?
Yes, doctor.
Okay.
I am taking regular care of him, and I think I told you, doctor. I think that his condition is getting worse. This also happened previously. His condition got worse when he had heart attack, and at that time he needed something called ICU support. Why aren't you going for that, doctor? His condition is getting worse, and I am really worried for him, doctor.
Yes, yes. Yes, okay. Uh, actually, at this moment, I'm sorry to say that he is not performing very well at this moment, and uh, actually, his his consciousness is not so well as well. Okay. We have checked his consciousness, and I'm sorry to say that it's been on the marginal level. Uh, are you getting me?
What do you mean by marginal level, doctor? Are you
Actually,
saying
he's
that he is
not.
going to die?
No, he's. I'm not. Very sorry, but at this moment we are not telling you. I'm not telling that. But his consciousness level is not up to the mark. Okay, he is not responding to our questions and queries very well, and uh, we tell it as something called GCS scoring. Don't bother about the term, but at this moment his scoring level is not very good. So we actually uh, took. Took advice from our consultant. So he checked him thoroughly, and he gave his opinion that an ICU care would not be appropriate for him.
Why not, doctor? He needed this before, and he went well after taking up after going to the ICU. Why not this time?
Yes, I can get it. Well, actually, uh, at this moment, he is actually overburdened with a lot of conditions. Like he has been suffering from some weakness in his right side till his morning. We are yet to know fully about the cause of it. Secondly, also he already has some breathing issues and some heart attack issues. And now the latest on we have been finding that his consciousness is not very well as well. The problem with that is that in ICU there can be some very aggressive treatments, and for this at times it's important that the patient has some uh, it's important that patient has some good functional capacities, okay, before. But I'm still I'm afraid that uh, at this moment your father might not be that much fit for getting admitted to ICU. Are you getting me?
Okay, doctor. So what are you telling that he's not going to he's going to die like this?
uh, no, actually, at this moment may I go tell you something more in details
Okay, doctor.
now? Yeah, well, at this moment, we are actually giving him the best treatment as possible. It's not that we are sure that he is going to deteriorate in a very short time. We are not very sure about it, but it's true that his condition is not very looking very good to us. But we are treating him in the best possible way. However, we are thinking about the future as well. We told you that an ICU might not be totally appropriate for him, and also in his lung and heart condition that he has COPD, some cancer, and also previous heart attack. Uh, we afraid that at times in these type of patients, a heart or lung can stop working altogether. Are you getting?
Yes, doctor.
Yes. So medically, we call it cardiopulmonary arrest. Have you ever heard of it?
No.
Okay, so it's a condition when this heart or lung can stop working. So what happens is that uh, in sometimes if this cardiopulmonary arrest occurs, in some patients we can attempt some measures to to get him back to life. Okay, but I'm sorry to say that we checked with our consultant that he uh, gave opinion that he's actually in a condition when he's overburdened with his lung, heart, and his memory problems. Specifically, on his heart and lung problems, and his total present consciousness level actually uh, indicates that he might not be uh, appropriate for that measures that we take
Okay,
in
doctor.
case.
So you're not going to take him ICU. You are not going to give him that specific measures. So that means that you are letting him to die.
Uh, well, Actually, it's not like that. I'm very sorry to say, and I can understand your condition right now. It's not like that at all. We are giving him the best treatment we can, but we can. But actually, I'm sorry to say that at this moment we think that he is not um at a very good condition, and if he goes in that type of condition, like stopping his heart or lung, it might not be useful at all to try him to do some specific measures. Rather, it can cause him much pain, and it can cause him much more trouble as well. So we at this moment think that we should continue our we thinking that we should continue our present treatment, and we should also uh, try him to treat him in the most dignified way, and give him the most comfort as that we can. Are you getting me?
Okay, doctor. It's actually shocking news.
uh,
So you are
well,
thinking
actually,
that he is going to die soon?
uh, actually, at this moment, we are sorry to say that although we are not totally sure, but we don't think that his conditions are very promising. Rather, we I'm very sorry to say, but I think that he's actually now on a very bad shape. Okay, so we cannot tell for sure, but uh, we are actually reviewing him all the time, and it's not that our decision is final. If he through the treatment, if he gets better, okay, then we will review him again. Please don't get isolated or disheartened that we are leaving your father.
Always
Okay,
meaning.
we are treating him the best possible way. At this moment, we don't think that it would be right to shift him to ICU or give him that support, because it will be might be very painful and non undignified for him. But if he improves under our treatment, okay, then we will again review that whether we can shift him to ICU or give him the some specific treatments or not. Are you getting me?
Okay, doctor.
Yes. Is there anything more that I can tell you, or uh, you would like to know?
Oh, doctor, you have explained everything well.
May I know that uh, do you may I actually know that that it's also very important that did he, while he was well, his consciousness was well, may I know that did he express any special wish of how to get being treated in these type of situations?
No, doctor.
Okay, I am sorry. And may I know that did he, do you know of whether he made any advanced decisions himself, like advanced directive?
No.
Okay, or have we ever appointed any specific person, which we tell at lasting power of attorney? Or did he give anyone that leverage? Did you know of it?
No, doctor.
Okay, and may I know that can you do you have any arrangements to go back to your place, or do you need any help from us, any financial help or any social help or anything?
Only one thing, doctor.
Yes.
Please do the best what is available to you.
Yes. Okay. Okay. We will try our level best. Please be assured of it. Okay. We will try our level best for your father.
I'm up.
Okay.
So, are you ready or one time?
Yes. 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 I'm ready.
What was your case?
Okay. Is that why inappropriate to attempt resuscitation in the event of cardiopulmonary arrest?
Okay. And what do you think? You could have convinced him well?
I think that I convinced him quite well enough, because he has a multi-system disorder patient. Uh, his condition is not well at this moment, and there might be impending chance of further deterioration. And at this moment, it's very much important to give him as much relief from any pain or anything like that. But I also didn't tell him to give up hope at all, because if he improves, we might review him again, and then our decision might change as well. I think I gave him both the aspects quite clearly.
Okay. So I'm going. Can you tell me that what was the scenario?
He admitted to hospital with right-sided hemiparesis till morning. Previous history of lung cancer, COPD, MI, dementia. DCS, I think, is 6. And ICU care, the specialist consultant told that special care was inappropriate for him. Resuscitation was also inappropriate.
Okay. Then why do you? Is there any? Do you have any idea why ICU support is inappropriate for him?
I don't have a. I don't. I can guarantee it fully that I know, but I think his DCS scoring, old MI, COPD, all of these things combinedly, specifically his DCS scoring, I think.
No. GCS scoring is an indicator for ICU referral.
Okay.
Not a hindrance to ICU ICU support.
Okay. Then what?
Okay. So I'm discussing. Okay, first you have introduced yourself well. You have introduced. You have confirmed patients. The relatives identity, that was very good. Actually, one thing that you have, patient was saying that okay, I love I take care of my father. I have left my job. At that point, you didn't show any sympathy.
Yeah.
Okay.
Hmm.
And also the patient was talking about that why aren't you shifting him to the ICU? You didn't give him answer, and also there was something that why did his condition deteriorated?
Hmm.
Okay,
Hmm.
you haven't give the answer because he has some past medical condition, and today he has developed right-sided hemiparesis. Then I could if you said that, then I would ask that why he has developed this. Okay.
Sorry, can you just add again? I couldn't get.
Okay, I asked you that why his condition has been deteriorated. You didn't give me a good answer for that. If
What should I have told?
okay, you could say that okay, as you know that he has some previous condition like some lung condition, some cancer in the lung, and also
Hmm.
heart attack and
Hmm.
forgetfulness. And today he
Hmm.
has developed weakness on his right side. That can be due to few causes,
Hmm.
and some clotting in the brain. Or also it can be caused by the cancer in the brain that has spread.
Yeah. Hmm.
So his condition has been, I would say,
Hmm.
deteriorated. So
Hmm.
okay.
Hmm.
At that time I could have asked, okay, I can understand. So what did you do for him? What are you doing for him? Okay, we are going him the best treatment. And after that, I asked you that why aren't you shifting him to the ICU? At that point, you
Hmm.
would have known. Okay, have you? Do you have any idea what we do in the ICU?
Hmm. Hmm.
Okay,
Hmm.
why are you especially saying that? They have. Did he ever have been sent to the ICU? Then okay,
Hmm.
to
Hmm.
actually to treat him in the ICU. ICU, we are give him some machine
Hmm.
breathing, and that can need a specific sub that also needs a certain level of tolerance. Your father's previous condition was bad, and at this time
I still have some settings. Well, what you told what has you has some settings or what?
okay, ICU settings have some need some medication, some machine support that
Hmm.
also needs a level of tolerance to the body. Your
Yeah.
father's condition, previous condition is bad, and also this time his condition has been mass worsened by this type of attack. Okay, for this
Hmm.
this type of
mm,
messaging would
mm,
not bring any good for him. Rather, it will cause him
mm,
mass distress.
mm, mm. Okay.
And after that, I have asked that is he going to die?
Mm,
Okay, his condition is very poor, and I cannot tell you exactly what his condition is.
mm,
Very,
mm,
very bad, and I am
mm,
sorry that
mm.
it's unlikely to be going to good.
Yeah. Okay.
Yeah.
Mm,
After that, okay, then his heart's condition, lungs condition is also bad. And may I know that do you have any idea that have your father have expressed ever any that what could be done or what should be done in this situation, any specific in this situation, if his heart's condition or if his lung condition get worse? Then I could say, okay, no, I do not know anything.
mm,
Then
mm,
okay, actually, as I told you that his condition is not good. So at this point,
mm,
if his heart stops working,
mm,
lung stops working at
mm,
time, do you have any idea that what we do? Okay, I do
mm,
not have any idea. Okay, we do the cardiopulmonary resuscitation. We call it CPR.
mm,
Have you ever heard of it? No. Okay.
mm,
With this, we actually try to revive the heart's function and lungs function. But
mm,
he has been reviewed by our consultant, senior doctor, and they found out that your father's condition is very bad, and making those attempts would not bring anything good for him. Rather, will increase his
mm,
suffering. Will increase his suffering.
mm, mm,
Okay.
mm, mm.
After that, okay. So that then okay, why aren't you going to treat him? Then is he in any pain? I couldn't ask you because you didn't give me good answer. Is he any pain? Is he suffering now?
Mm,
Then you could say, okay, his scoring is yes, we call it GCS, that is very low, so it is likely that he is not suffering. He cannot receive pain at this moment.
mm, 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 mm.
That is fine. You did everything well.
Okay. I think I tried, but I couldn't touch all the topics here, points.
Yes, uh, next time you will do it.
Okay. So how? Okay, can you just stop the recording now?